Hello, everyone. I am the Doctor of Disaster, Mark Warnick. I have a PhD in public safety, and I'm recognized as a subject matter expert for not one, but two universities. And now we begin part 5 of the coronavirus series. I will also talk about how to properly put on gloves and to take them off in a later video. So, after you wash your hands, make a conscious effort to avoid touching your eyes, nose, or mouth. Practice good health habits. Get plenty of sleep, be physically active, manage your stress, drink plenty of fluids, eat nutritious food, and clean non-porous surfaces with disinfectants. All of these will help prevent you going downhill should you get the coronavirus. Now, this is something that you can't do after you get it. You've got to be doing it all along. So what happens if you need to seek medical help? I suggest that you only call an ambulance if you need one. If you think you're infected and you can drive yourself or someone can drive you, you should call ahead to your doctor's office. You should avoid emergency rooms and urgent cares unless you are very ill, having difficulty breathing. If you just feel cruddy, which coronavirus will do, no problem. You start having shortness of breath, there's a problem. Upon arrival at a doctor's or doctor's office, hospital, whatever, you should place a face mask over the nose and mouth of the patient that may be ill. The reason for that is so it won't come out. Cough etiquette, which is make sure that you cover it. Now with cough etiquette, make sure you don't put it in your pocket, or throw it on the table. What that'll do is spread the germs. Hold it in your hand until you find a receptacle, a trash can, with a plastic bag, and drop it in there. If you're ill, you should carry the hand sanitizer, the little ones, which is something else you should probably add to your list, and wash your hands after you've touched it. That way you help prevent the spread. Good hand hygiene is another one. If you're at the doctor's office and you are ill, try to stay at least 6.5, 7 feet away. We know that it can travel up to 6 feet with a sneeze or cough. When going to a healthcare facility, try and isolate yourself and your family members from others that may be infected. If need be, you can wait in the car and give them your phone number. You may have to go in to be triaged, head back out. Before you head out, say, here's my phone number. Call me when you're ready. I want to stay away from everyone. Nothing wrong with that. If you're going to the doctor's office or the hospital or anywhere, and you want to protect yourself from others that may be infected, you might want to take precautions such as an N95 mask and hand sanitizer that has between 60 and 95% alcohol base. Are you getting bored yet? When you get to the hospital, you hope that the hospital will keep everyone that may be infected in a specific area away from everyone else. That would be the smart thing to do. Additionally, if you think you're infected with coronavirus, use a separate bathroom if it's available, or ask if they have a separate bathroom. So, what do we do if animals, our pets, are showing signs of the coronavirus or COVID-19? Well, you should restrict your pet's contact with other animals, and you should keep them away from you if you're sick. When possible, if you're sick and your animals aren't, have someone else in the house take care of your animals. One of the things that we've discussed in my house is if one of us gets sick, we'll put up a pet gate or a child gate to prevent our dogs from coming in and out so they don't get sick. This includes avoiding contact such as petting, snuggling, being kissed or licked by the animal, or sharing food with the animal. Yes, sharing food. If you have to take care of animals yourself, or you have to interact with them when you're sick, you should wash your hands before you do anything with them and wash them afterwards. And wear a face mask. Once again, if you're going to visit a doctor, call in advance. Tell them that you may have coronavirus. And let them tell you what steps to take to keep others from becoming infected. If you get infected, wear a face mask when you're around other people, such as sharing a room or a vehicle, or pets, and before you enter a healthcare provider's office. If you're not able to wear a face mask, then people should not stay in the same room with you, or they should wear a face mask if you enter the room. Now, there's people that can't wear face masks because of respiratory problems, and it causes a lot of problems, and that would make it so they couldn't wear them. If you're cohabitating with someone, you should make sure that you cover your coughs and sneezes from both your mouth and your nose. Use a tissue or toilet paper. Throw used tissue in a lined trash can. Immediately wash your hands with soap and water for at least 20 seconds. If you use hand sanitizer, once again, 60 to 95% alcohol. Cover all the surfaces of your hands and rubbing them together until they feel dry. Soap and water should be used preferably if hands are visibly dirty. So when you wash your hands with the hand sanitizer, make sure you do this and this, all the way up to your wrist. Get it all over. Do it until it's dry. You should clean your hands often, and you should avoid sharing personal household items with others who aren't infected. So in other words, you shouldn't share dishes, glasses, cups, eating utensils, towels, bedding, any of that with other people or pets in your home. Additionally, you or the other person in your home wearing protective gear should clean all high-touch surfaces, including counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, and bedside tables. Also, clean any surfaces that may have blood, stool, or body fluids on them. Make sure that you use the proper cleaner and probably follow up with at least 10% bleach solution. One of the things we've talked about is after we go to the bathroom and flush, we'll probably put a little bit of bleach in the toilet to ensure that it's killing everything. If at all possible, put on a face mask before. Now, I'm going to say this is my personal opinion. I've been reading stuff from the Center for Disease Control. My personal opinion is don't call an ambulance unless you need to. Why? What if someone else had the virus, was in there, and they missed a spot when they cleaned it and disinfected it? I'd rather be safe than sorry and take myself. So the CDC goes on to say that patients with confirmed coronavirus should remain under home isolation precautions until the risk of secondary transmission to others is thought to be low. The decision of when to stop home precautions should be made on a case-by-case basis. So if the doctor tells you isolation for 14 days, what they'll probably do is have you checked out, and they may say you need to do another 7 days. So that's why it's a case-by-case. And it may not only be your doctor, it may be the health department too. Make sure to like and subscribe to the Doctor of Disaster. Hit that button over there. Stay tuned for the next episode of the Doctor of Disaster. Don't forget to get your copy of the Doctor of Disaster's book, Emergency Incident Management Systems, at Amazon.com. This book is the go-to on managing disasters and on the Instant Command System.